The Connecticut Hospital Association is pleased to present the 2025 John D. Thompson Award for Excellence in the Delivery of Healthcare through the Use of Data to Stamford Health for its comprehensive preoperative optimization program.
I started in the POP program in 2017 with the initiation of the program.
POP stands for Preoperative Optimization Program.
The goal of the creation of POP was to cut down on day of surgery cancellations.
There were some patients who were simply unprepared for surgery, or we were unprepared to perform surgery for them. And a lot of these cancellations were, quite frankly, preventable. We realized there was way too much variability in the process. We needed to strengthen that process of preoperative planning.
One primary care doctor would use one set of criteria, another primary care doctor would use another set of criteria. The hospitalists are experts in inpatient medicine. We felt that having a core group of hospitalist physicians who work in the POP clinic can use standardized medicine and use the same criteria for evaluating and clearing patients. They become the conductor and they help coordinate the care.
The POP visit is the beginning of the patient experience. Ideally, we schedule patients 7 to 14 days out prior to their surgery, and the appointment lasts about 90 minutes. We can see up to 23 patients a day. Often days we are full at capacity. The POP visit is a face-to-face interaction with the patient. That fosters patient involvement and accountability for their own care. This is where we educate the patient to the surgical plan from start to finish. This will include all phases of care, from pre-op instruction for preps, medications, infection prevention, and post-op planning. From an education standpoint, we know that we're providing the patients with the tools that they need to have a successful surgery.
We have a checklist to go through for every single patient, whether that's testing them for sleep apnea, whether it's making sure they don't have antimicrobial resistant bugs, to make sure that they're going to have their airways assessed the same way every single time. That gives everybody more confidence on the day of surgery. It gives the surgeon more confidence. It gives the anesthesiologist more confidence. Most importantly, it gives the patient more confidence.
Almost everyone that walks out says they've never had an evaluation like this before.
Any patient that is going to be admitted to the hospital, or so-called inpatient, would undergo this preoperative evaluation. There's been a tremendous success with the POP program. Our complication rates have reduced by about 73%, and mortality rates over 50% reduced over the space of the time that we've implemented it from 2017 to the present.
Our system is built on quality. We have almost every quality indicator you could have for Stamford Health. And so showing that quality with decrease in cancellation rates and decrease in postoperative complications obviously is very important to our organization. NSQIP is a National Surgical Quality Improvement Program, and it looks at the data of all our cases that we operate on and compares us to the other hospitals in the country that are part of the NSQIP program. Adoption of the POP program and the decrease in NSQIP data correlates fairly well.
Education is the most important part of preparing any patient for the surgery. Every patient is unique, and every patient, even though 10 patients may have a similar surgery, they might need a different approach. It is a journey starting from their physician office all the way in the pre-optimization phase. We are thinking about their discharge from the day they walk into the preoperative optimization clinic. We are thinking of their rehab. We are thinking of where they're going to go after surgery.
They love the fact that we were going the extra mile to make sure that they were safe.
The comments come back that I came in, I was so anxious. I didn't know what to expect. Your staff was amazing. I feel so well prepared. I understand what the next steps are.
Everybody involved in the preoperative process, really through this process, gets invested in the patient. And the patients sense that. Anything worthwhile to do is hard. And I think this organization has really come together to work as a team to do something hard.
We are constantly thinking about making it better. So next time when you come around, it's going to be bigger and better, even bigger and better.
There's no way of going back to how we were practicing before 2017. There's no looking back.